Explanation of the dopaminergic synapse. Step-by-step dopamine pathway. 1. Synthesis of dopamine. Starts with tyrosine converted to L-DOPA, then to dopamine. 2. Storage and release. Dopamine is stored in vesicles until an action potential triggers its release into the synaptic cleft. 3. Receptor binding. Dopamine binds to dopamine receptors on the postsynaptic neuron, leading to signaling effects, e.g., mood, motivation, reward, movement. 4. Termination of signal. Dopamine is taken back into the presynaptic neuron via the dopamine transporter, DAT. Once inside, dopamine can be repackaged into vesicles or broken down by enzymes. Dopaminergic stimulants, shown in image. Amphetamines enter through DAT, displace dopamine from vesicles, and reverse DAT, causing dopamine to be expelled into the synapse. Methylphenidate and cocaine block DAT, preventing dopamine reuptake. More dopamine remains in the synaptic cleft. USMLE questions? Question 1. A 12-year-old boy with ADHD is prescribed methylphenidate. Which of the following best describes the primary mechanism of action of this drug? A. Enhances dopamine degradation. B. Inhibits vesicular monoamine transporter VMAT. C. Blocks dopamine reuptake via DAT inhibition. D. Stimulates postsynaptic dopamine receptors. E. Inhibits tyrosine hydroxylase. Correct answer C. Blocks dopamine reuptake via DAT inhibition. Explanation. Methylphenidate acts like cocaine by blocking DAT, increasing dopamine levels in the synapse, and improving attention and focus. A. That would reduce dopamine, worsening symptoms. B. VMAT inhibition reduces dopamine release, e.g., tetrabenazine. D. Direct receptor stimulation is not its mechanism. E. That would reduce dopamine synthesis. Question 2. A patient presents with elevated mood, reduced appetite, and increased energy. He admits to using a recreational drug. Which of the following mechanisms is shared by both amphetamines and cocaine? A. Blockade of dopamine receptors. B. Inhibition of MAOB enzyme. C. Direct stimulation of dopamine receptors. D. Increased dopamine in synaptic cleft. E. Inhibition of tyrosine hydroxylase. Correct answer D. Increased dopamine in synaptic cleft. Explanation. Both amphetamines and cocaine increase dopamine in the synapse, but by different mechanisms. Cocaine blocks reuptake, DAT inhibition. Amphetamines displace dopamine from vesicles and reverse DAT. A. They do not block receptors. B. MAOB is involved in dopamine degradation, but not targeted by these drugs. C. Not direct receptor agonists. E. Tyrosine hydroxylase inhibition reduces dopamine, opposite effect. Question 3. Which of the following would most likely decrease dopamine levels in the synaptic cleft? A. DAT-T inhibitor. B. Amphetamine. C. Tetrabenazine. D. L-DOPA. E. MAOB inhibitor. Correct answer C. Tetrabenazine. Explanation. Tetrabenazine inhibits VMAT, preventing dopamine from entering vesicles. Without storage in vesicles, dopamine is degraded, less release, decreasing synaptic dopamine. A and B increase dopamine levels. D. Increases dopamine synthesis. E. Inhibits breakdown, increasing dopamine.